Recording in progress.
Is that on your end, Matt?
We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nishnawbe, Ishkildwen, and Nishnabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Good evening, everyone. All of a sudden I have lost video, so I'm not sure if you can see me. It shows me my video is on, but I don't see myself, so I'm not sure. Hopefully we can rectify that. But I'll call the meeting to order at 5:08. Before I do that, or we'll call the meeting to order at 5:08. And before I ask for any declarations of conflict of interest, I would just like to ask, I'd just like to give the board an opportunity to address them regarding two recent resignations that we've had from the board of directors. These resignations include Penny Allen and Michael Lavoie, and would like to take the opportunity to thank Penny for her many contributions and wish her all the very best as she focuses on her retirement. And the other empty chair we have at the table today reflects the emptiness in our hearts as we think of the loss we've experienced with the passing of Michael Lavoie. In Michael's resignation letter that he sent to me on January 12th, just a week before his death, he told us, and I quote, "I have never served with such a great group of individuals. It has been an honor and privilege to serve this board and this community." He also instructed me to thank all board members for all of their support and contributions to the community, the sort of activity, of course, that Michael epitomized throughout his life. Finally, with his typical wry humor, he added this message: "When you or David next see Doug Ford, whisper in his ear that he and if the ministers don't get this hospital project moving forward, that I will haunt them forever." While I fully expect that he will deliver on that promise, the example of his life so well lived also provides us with yet more incentive to not just get this project moving forward, but to see it through to its completion. We will certainly remember Michael then when we are cutting the ribbon. And I ask that we each take some time to remember him right now as a friend and a colleague with a moment and a minute of silence. Thank you, everyone. I will now ask if there are any declarations of conflict of interest. Okay, seeing none, I will move forward to item number 3, which is the previous minutes of January 4th, 2024. They are found in tab A. Hopefully everyone's had an opportunity to review them. If I can please ask for a motion to approve. Paul, thank you. Dr. Freeman seconds. Any additions, modifications? Okay, seeing none, all in favor? Thank you. Those minutes are approved. And David, that brings us to the report of the President and CEO.
Oops. Yep. Thank you, Madam Chair, and I agree with you. Michael was invaluable to the board of directors, and he had a serious side to him all the time, but he did still like to have some fun. And as you stated, Penny Allen's served an amazing tenure as a board member and treasurer of the board and has done a great job, and I wish her best moving forward. But those are two big losses for the board. Tonight, before we begin, since we're talking about people leaving and coming, tonight is Teresa Morris's last board meeting. She gets to retire. So we're allowing her to retire. She's tried before and we refused to accept it. So she's retiring, but she is being replaced in capable hands by Christy Cecile, who's here with us tonight as well. But Teresa has had an invaluable imprint on healthcare across our region in Windsor, Essex, of course, and Windsor Regional Hospital for decades. And I wish her best with her husband, Tom, who is also a former employee of Windsor Regional Hospital. He got a jump start on her and retired a few years ahead of her. And the two of them are now going to spend some time together with their family and grandchildren. And I wish Teresa the best because she's given us the best. So congratulations, Teresa. And of course, welcome Christy to the fold. So where are we at with respect to our influenza season across Canada? The blue solid line there is the current tracking. And as we talked about last board meeting, and this goes to the first week of January, the volume has gone down. The number of positive tests has gone down. And as a result, the average is the dotted line for the last 6 or 7 years. And you'll see that we did not go as high as the peak as even the average. And as a result, we're starting to descend, and hopefully that continues. And we've seen that also internally, which we'll talk about a little bit later. So when you look at wastewater surveillance for influenza A, you'll see it's still at a higher rate, but it's starting to descend. And this is more up-to-date data than the previous screen. So it's starting to decrease. Hopefully that decrease continues. However, in the past, we've had decreases and then it goes back up. But that's generally what happens is as it goes down on a staggered basis. So again, hopefully we start seeing this sustained reduction down over the next couple weeks, months. Influenza B is, we talked about this previously, if there is to be an extension of the influenza season, it's seen in influenza B, the other strain. The numbers are relatively small, but you could see it bounced up since late January as we are now, and starting into February. So hopefully these numbers are as high as it's going to get, and that's as far as we're going to go with influenza B. When we get to COVID, as seen on this chart, the wastewater indicates that the COVID indications in wastewater are going down. And that is consistent also with what we're seeing in the hospital. And RSV, as we talked about a couple months ago, we hit our peak in and around November, and it started to go down, and it sustained that level for the last couple of months as well. So over the last 12 months, if you look at our data and where the blue line is COVID, the green line is RSV, and the orange is flu. As stated and consistent with the wastewater data, is our numbers are starting to descend a bit. RSV, consistent with the wastewater, has stabilized, but at a lower amount. And influenza, of course, as stated there, and also COVID has gone down, and our number of inpatients continue to go down. And instead of being in the 30s or 20s now, even they're into the teens, which is good. And they hit the single digits, but bounce back up a little bit. So again, we're starting to see some better relief with that data moving forward. So hopefully we've seen the worst of all of the seasons, but that doesn't mean that there isn't still, as shown, influenza and COVID around. It's just hopefully on a descending scale moving forward. And this just shows our COVID patients by the day. There was the increase in the new year, and it started to decrease nicely, gone up a little bit, but again, on a decreasing scale. So that's very, very positive. We still have the masking that's been in place. That will continue in place until we start seeing a sustained drop in influenza. So again, visitors are to mask in and around patients, and that's going to continue. But hopefully by the time we meet at the next board meeting, we'll have news where we can start looking at making some relaxations of those rules. A couple big announcements today. The first related to the Ministry of Health expanding the number and access to family health teams, and a significant investment of $110 million to not only increase the number of family health teams, but also providing hopefully some extra monies to existing family health teams. So since 2010, Windsor Regional Hospital has had a affiliation agreement with the Windsor Family Health Team, and the Windsor Family Health Team sees over 10 or has rostered over 10,000 patients. And that means 10,000 patients not only are able to see a physician if they attend the Windsor Family Health Team, but all of their team members, and get a holistic view of their care, and are able to get a lot of their issues resolved with the family health team under primary care guidance. This is critical and has been seen as a very positive model. So since our relationship and affiliation with the Windsor Family Health Team, what we've been able to see is that those rostered patients, their attendances to the emergency department are less. And if they do have attendances to the emergency department, they're followed up by the Windsor Family Health Team rather rapidly to determine why they had to attend and to avoid future attendances to the emergency department for this care. So it's been a great relationship since 2010 and very positive. And this is the type of positive news that will help address some of the demands that are in the community regarding individuals without access to primary care, and really having only the emergency department as their option if they do get sick, especially in the later afternoon hours and into the weekends and on the holidays. So by making this significant investment, it is a great move by the Ontario government to expand, again, not only the numbers of these health teams, family health teams, but also access to existing family health teams. So we look forward to operationalizing this announcement and expanding it, hopefully in Windsor and Essex County, to the various family health teams, and allowing more people to be rostered even in Windsor, Essex, which again will help individuals have a spot to go when to avoid having the emergency department as their only option. So we look forward to hearing more news with respect to this, but a big announcement today. The second big announcement today is Dr. Catherine Zahn, who's the current Deputy Minister of Ontario, of Health, in Ontario. She's moving over to become the new chair of the Ontario Health Board, and really have developed a close relationship with Dr. Zahn since she came into power in 2021. She's has been an amazing deputy minister for the province of Ontario in my tenure in health, which is closing in on 25 years. Never had a closer relationship with a deputy minister. Just so you get some context of what Dr. Zahn did, aside from her general leadership and inspirational leadership during some of the most difficult times in healthcare over the last few years, she would reach out regularly and just cold call to touch base, to get a feel with respect to what's going on at the hospital and get an idea of what's happening and to get some feedback, or if she was thinking of certain initiatives or certain ideas or certain issues, she'd call to bounce them off to get some feedback. And she would call various institutions across the province for that. And in return, she was always available to answer the phone. If I ever had a question or an issue as recent as, during the cyber attack, asking for advice on how to navigate certain issues, she was there. She immediately responded and dealt with the issue herself personally. So I'm going to miss Dr. Zahn as deputy minister, and I look forward to her replacement. But at the same time, I am glad she is staying connected to a leadership position, and I look forward to her leadership as the new chair of Ontario Health and to move healthcare forward in the province of Ontario. So that's again two big announcements today made by the ministry. So I am going to now pass it over to Karen to give an update on the Code Gray status. Karen?
Yeah, thanks, David. Good evening, everyone. So as we had reported back in at the beginning of January, we had gotten our PAC system up and running. And as a reminder, that's our image storing, reporting system for diagnostic images, and allows for our radiologists and physicians to interpret, diagnose, and treat patients. And as an update, our P1 and P2 are emergent and semi-urgent. We had no backlog, but we do have a backlog with our P3s and 4s. So our less urgent or semi-urgent priority and non-urgents. So it's going to take us about 10 weeks to clear our P3s. And we're working currently with our regional partners in Ontario Health West to come up with a recovery plan. So as everyone is aware, Windsor Regional was one of 5 hospitals impacted by the criminal cyber attack. So we'll all be working together to make sure that we're able to get those wait lists down. So we have kept our physician offices informed of the wait times to ensure patients are directed to other hospitals for imaging, or if they're appropriate to wait. And if anyone needs to be reprioritized, they can send those referrals back to us. If there is any questions about that, our diagnostic imaging department can be reached directly at the phone number that was on that slide, 254-1727. And so just an update on the systems that we brought back online in January. So Seaboard is our nutritional software, and that allows for individualized meal ordering options. Our lab system, our last module that we had been working on, is now fully integrated. That's our hematology module. The systems that we are going to get back online in the next few days include Pyxis. So that's our automated medication dispensing cabinets. So those should be fully integrated and live on Monday, by the end of the day, Monday next week, with a full go live on Tuesday. And CVIS, which is our cardiovascular information system. So it's like our DI PAC system, but used for cardiac imaging, echoes, diagnostic tests such as EKG reporting. We use it in our cath lab for a hemodynamic system. Is actually going to be live as of tomorrow morning. So we are currently using it, and we're just testing it overnight. So we have lots of systems left to bring back online. However, these last 2 systems, Pyxis and CVIS, were part of our last big clinical impact systems impacted. And it will have reached a major milestone with the restoration of those 2 items. So if all continues as planned, we are going to lift our Code Gray effective Tuesday, February 6th. So that's our when we go live with Pyxis. So that's some good news. Teams have been working really, really hard the last few months to get everything back up and running, and we'll continue on with the work to get things back online over the next few months. And that's the end of my portion of the report. Thank you, David.
Thank you. And that's our report, Madam Chair.
Okay, thank you, David, Karen. Appreciate all of that. Any questions from anybody on either one of the reports? Okay, seeing none, those were for information, so no motion is required. So that brings us to Dr. Jacobs and the Schulich report.
I don't believe he's here, Patty.
Okay, perfect. Okay, so thank you, Dawn. So that was for information. And that brings us to item number 7. There's no financial presentation from Anthony this evening. So that brings us to the consent agenda. And Anthony, I believe that you're going to give us an update on the January 22nd, 2024 report.
Yes. So just very quickly, with regards to the Finance Audit Resource Committee, they're still working through the Code Gray financials. We're working with our accounting firm, KPMG, to work towards being able to finish our year end off and get our audit kicked off. They're starting some preliminary testing, or are looking at doing some preliminary testing pre the cyber attack, get what they can do done there. And then as we work to get everything back up and accounted for appropriately, they'll start working on essentially the October through March 31st. We still got a ways to go to validate all our data. There's going to be some journal entries that will have to be made, but overall, the accounting staff is doing a fabulous job keeping things up and running as best they can. So, they don't get the glory that other departments get, but they're doing a heck of a job under these circumstances. So, with that, I will move the consent agenda.
Thank you, Anthony. Will someone second? Genevieve? Okay, any questions for Anthony? Okay, seeing no questions, all in favor? That motion passes. Thank you, Anthony, and thank you, Melissa. We know you and the team are always doing wonderful work, so we appreciate it, especially during these challenging times. So thank you. Item number 9, correspondence and printed material, is in tab C. And I also just want to take the opportunity to, under communications, to congratulate Windsor Regional Hospital. They are the recipient of the 2024 Believe Windsor Essex Award. So congratulations to Karen, David, Wasim, the entire Windsor Regional team. So well deserved, very inspiring. So thank you for that. And also the recent announcement about Windsor Regional Hospital championing the organ and tissue donation with those 3 awards. So a wonderful month for Windsor Regional Hospital. And certainly the hard work is noticed by many. So thank you and congratulations for those. And that brings us to number 10, board member questions, comments, or notices of motion. Seeing none, again, just want to congratulate Teresa and wish her a very, very wonderful retirement. And on behalf of the board, thank you. Thank you so much for everything that you have done. We truly appreciate it and wish you nothing but the very best. So congratulations, Teresa. And again, congratulations to Penny. And I know that we will all very much wish Michael, and we thank him for his many, many contributions. The next meeting is for Thursday, March 7th, and that will be in Zoom 2024. And I will ask for a motion to adjourn at 5:30. David, and seconded by Linda, all in favor? That passes. So thank you very much. And I will see everybody on the next link.